Welcome back. This will be the third of 4 segments on antidepressant pharmacology. And in this session, we're going to focus on the monoamine oxidase inhibitors and the tricyclic antidepressants, the 2 oldest groups of traditional antidepressant agents. There are numerous agents available in both the MAOI and TCA groups, and several of these will be recognizable to you from your autonomics lectures. Now, while I label them as older agents, please recognize that these agents are still used with considerable frequency. However, as we'll see, each group also has perhaps the highest number and severity of adverse effects, and you do need to be familiar with these when contemplating their use. The effects of an MAO inhibitor, MAOI, on the monoamine oxidase enzyme can be either reversible or irreversible and can inhibit both isozymes MAOA and MAOB or be more selective for one of these 2 isozymes. Phenylzine, isocarboxide, trinylcypramine, and selegiline are all irreversible. Only meclobamide is reversible within this group of agents. Selegiline is selective for MAOB, while meclobamide is selective for MAOA. In general, this group tends to cause amphetamine-like excitatory adverse effects with nausea, anorexia, insomnia, anxiety, and restlessness occurring with some frequency. Interestingly, the group also frequently causes weight gain. Antimuscarinic side effects and postural hypotension are frequent, as is sexual dysfunction in both men and women. The MAOIs comprise a group of drugs that can precipitate serotonin toxicities if they are combined with other agents that also elevate serotonin. We'll talk more about the serotonin syndrome. You will have heard about the serotonin syndrome already. Finally, you should remember that the MAOIs can trigger hypertensive crises when taken with certain foods or beverages, the wine-cheese effect. Our final MAOI slide is just a reminder of that wine-cheese effect. You will recall from autonomics that tyramine is naturally occurring in high levels in some red wines, beers, and aged cheeses, among other foodstuffs. Normally, it's destroyed mostly by MAOA before it can get out of the circulation and into noradrenergic neurons. The inhibition of MAOA allows penetration of the tyramine from the foodstuffs into the circulation and into then the neuronal synaptic vesicles, where the tyramine can displace norepinephrine into the synapse with increased sympathetic actions. In addition to monitoring their diets, patients on an MAOI should also be advised against the use of over-the-counter sympathomimetic drugs, as some of these can further trigger norepinephrine release to cause excess sympathomimetic actions. As with the MAOIs, the tricyclic antidepressants, or TCAs, are currently used less frequently as antidepressants than they have been in the past. But remember that they may still be effective for some patients. The action of the TCAs is to inhibit membrane reuptake of norepinephrine and or serotonin to varying degrees depending upon the agent. Like the MAOIs, they tend to be associated with weight gain in patients, but they also have significant antimuscarinic effects and can cause hypotension. However, they tend to produce sedation rather than behavioral excitation that is often seen with the MAOIs. And while they are less commonly used these days, overdoses of tricyclic antidepressants are considered to be life-threatening and problematic in their management. In the past, the TCAs have been a commonly used drug for suicidal attempts. This has become less common as we have issued fewer prescriptions for the TCAs in favor of other more recent drugs like the SSRIs. However, you do need to recognize the potential for toxicities associated with the tricyclic antidepressants and how they are managed. They have some significant features that are troubling. They tend to lower threshold for convulsions, and so convulsions are frequent in overdose situations. And they cause frequent defects in cardiac conduction that lead to serious arrhythmias. They have both sodium and calcium channel blocking properties associated with them. These can be challenging to correct. And finally, hypotension tends to be common, and this is in part due to the fact that many of these agents have some degree of alpha-1 adrenoceptor antagonistic actions in the molecules. The fourth and final segment will focus on the newer antidepressant agents that we have mentioned already.